Hi, my name's Nani. I'm going to be the nurse working with you here today. So I hear you weren't feeling well this morning. Can you tell me a little bit about what happened? What brought you to the emergency room? Okay, so you were starting to feel some like numbness and tingling on on your left side? Okay. All right, and then that brought you to the emergency room. They did a CT scan. I saw it on your chart. So we're just waiting for the results from that. Okay, and how are you feeling right now? Okay, a little bit better. All right, so I'm going to be doing what's called the NIH stroke scale for you today. So we're going to just, I'm going to ask you a couple of questions, have you do a couple of tasks, and we're just going to make sure that we establish a baseline for your abilities right now as far as the signs and symptoms of this possible stroke that you had. Okay, so I do have a checklist of things, and I'm going to be marking certain things off as we do these tasks, okay? And again, it's just to establish a baseline for you, just so that we can track your progress and how things are looking. And once we get the results from the CT scan back, the doctor will look over and they'll decide if there's anything that we need to do further. But this is just going to give us a nice scoring level to sort of look back on, and it'll help the doctor make decisions about what your plan of care is going to be going forward, okay? Yeah, of course. So I'm going to be going through all of this. I'll try to go through it slowly. Just try to do your best, okay? If you struggle with anything, don't worry. It's just part of the assessment, okay? Can you tell me your name, please? All right, and then can you tell me what month it is right now? All righty, lovely. And what is your age right now? How old are you? Okay, good. So I'm just gonna be marking some stuff here. Okay, now I'm gonna have you blink your eyes for me. Yep, just close them. Okay, good. Now can you take this hand and squeeze my hand? Okay, good. Let's do the same with this one. Good, all right. Perfect. Okay, now I want you to look at my finger and follow it with your eyes. Don't move your head, okay? Good. Good, okay. Okay, now can I have you cover this eye? Okay, and now I'm gonna wiggle my fingers and I'm gonna bring them close to you. Let me know when you see them, okay? Let me know when you see it moving. All right, go ahead. Okay. Okay. Good. Okay, now cover the other eye. Okay, same thing. Okay. Good. All right. Can you give me a big smile? Show me your teeth. Good, you have beautiful teeth. All right, and then can you raise your eyebrows as high as you can? Okay, good. And then can you scrunch your face up like this? Okay, perfect. So I do notice a tiny bit of drooping on the left side. Okay, now I'm gonna test your arms. So I'm gonna have you lift your left arm. Yep, lift it up straight in front of you, and then just hold it, and I'm gonna count to 10, okay? Ready? Okay, go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, now I'm gonna have you do the same thing with your right arm. Hold it out in front of you straight. Okay, same thing. Ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, good. You can relax. Okay, so there was a little bit of drifting on your left side. All right, now I'm gonna have you do the same thing with your legs. So I'm gonna ask you, I know you're laying down, so it can be a little bit hard, but I want you to lift your leg up straight and try to keep it up. I'm gonna count to 5, okay? So try to keep it up as much as you can. We're gonna start with your left leg. Ready? Okay, 1, 2, 3, 4, 5. Okay. And then the right leg, same thing. Ready? 1, 2, 3, 4, 5. Okay, good. All right. Now, I'm going to be holding my finger out. I want you to bring your finger up to your nose and then touch my finger and then bring it back to your nose. And we're going to do that back and forth a couple of times, okay? All right, starting here. Good. 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 Okay. Okay. Now we're going to do the same thing but with your legs, so it's going to be a little bit different, but I'm going to ask you to bring your heel up to your knee and then slide it down your shin, okay? We're going to start with the left leg. Bring your left foot up to your right knee. Okay, good, and then slide it down. Okay, now the other leg, same thing, but on the opposite. Yep. Okay. Now do that one more time for me, both legs, starting with the left. Okay, and the right. All right. Okay, now I'm going to be using this pencil. The tip is sharp over here, and then this one's blunt. So I'm going to be touching you on a couple of spots. I want you to let me know if what you feel is sharp or blunt, okay? All right, you can close your eyes. Okay. Is it blunt or sharp? Okay. Blunt or sharp? 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 Okay. Okay. So I see it's a little bit impaired sensation on that left side. Okay. Do you currently feel any numbness or tingling on your left side? Not really? Okay. But earlier it was pretty strong? Okay. All right, so now I'm gonna hold up this screen and I'm gonna ask you to describe what you see in a couple of images. I'm gonna ask you to first describe what you see in this picture, and I'll go over the rest of them in a bit. So can you tell me what you see here? Yep, just whatever descriptions you want to give. Good. All right, perfect. Now I'm gonna have you tell me what these items are. Okay, can you say what this is? Okay, good. What about this? Good. What about this one down here? Okay. What about the thing that's between the trees? Okay, good. What about this? All right. Good. And then that final image up there. Okay. Now I'm going to have you read a couple of sentences. Okay. Can you read these for me? Okay. All right. Thank you. Okay, so let me mark that on here. Now I'm going to have you read some other words here, and I want you to try to enunciate them as best as you can, okay? So start with that top one. Okay, the second one. Good. Third. Okay, fourth. Okay, fifth. Sixth. Okay. Thank you. So let me go ahead and jot that down. Okay. Now I'm going to have you look right here at my nose. Okay. And I'm going to wiggle my fingers, and I want you to let me know which side you see me wiggle my fingers on, okay? Okay, ready? Look at my nose. Which side? Good. Which side? Okay. Good. Good, okay. Now can you close your eyes for me one more time? I'm gonna touch you in a couple of different spots. I want you to let me know where you felt me touch you, okay? Okay, so close your eyes. Okay. Good. Good. Okay. All right. So you did feel it on both sides, but you said that it's a little bit fainter on the left side. Okay, so let's see. I'm just gonna add up here the total score. So, all right. So it looks like your total score on this baseline test was a 4. So again, we're going to keep monitoring it. We're going to do this same exact assessment every, well, depending on what the provider prescribes and the results of the CT scan, but we're going to be doing them a couple of times. We're going to make sure that it's not getting worse. We're going to see if the different scores improve at all on certain things. So the left side, the things that you were feeling some kind of decreased sensation on, things like that, we're gonna see if that improves at all. Okay. But yeah, a score of 4 might mean that you had a small stroke, like not a severe but a mild one. It could also mean that you might have had a TIA, which is basically what people refer to as a mini stroke. Yeah, so The thing with those TIAs is that they can technically put you at risk for having a more severe stroke later on. So again, depending on the results of that CT scan, the doctor is going to decide what course of action to take, okay? And they're going to use this stroke scale assessment into consideration as well, just to see what kind of treatment you might need and where we're going to go from there, okay? And how long we're going to monitor you for. Yeah, of course. So if you have any questions, any concerns, please let me know. I'm going to be here the rest of the shift, so I'll be coming in to check in on you periodically and to redo that assessment depending on what the provider prescribes for you, okay, for the course of treatment. Yeah, of course. Alrighty. Is there anything else I can get you for now before I head out? Oh, yeah, I know. I'm sorry. I know you're a little bit hungry. Now, since you did just come in not too long ago, and you do have a suspected stroke, you're not going to be able to eat anything for the time being until the speech language pathologist comes by and is able to do a swallow study on you. We want to make sure that you don't have any issues with swallowing that could cause you to choke. Yeah, because sometimes when someone has a stroke, you know, since you were feeling that numbness on your left side, it could also affect the left side of your mouth or your throat or things like that. Yeah, so unfortunately for now, you are NPO, so you can't take anything by mouth, but I think the speech language pathologist should be coming in shortly. They'll do an evaluation on you, and depending on what they say, we can change that dietary restriction up, so then that way you're able to get something to eat, okay? Yeah, of course, no problem. Alrighty, I'll see you in a little bit, okay? Okay.